Storytelling, Unleash the Power of Personal Narratives, a distance learning event presented by Michelle Ames, Jennifer Morse, and Stacy Anderson, and hosted by the Community Health Association of Mountain Plains States, also known as CHAMPS, and Colorado Community Health Network, also known as CCHN. I'm Valerie Steinmetz, the program's Outreach and Enrollment Coordinator for CHAMPS, your Region 8 Primary Care Association. I will be moderating today's webinar. Before we get started, I want to touch on a few housekeeping items. Please be aware this webinar is being recorded. All phone lines are muted. If you are hearing an echo, please mute your computer screens and listen in through the phone line. If you are logged in on the phone or on the computer and want to also listen on the phone line, participants go to the top of your screen and click on info. You'll see a phone number and the participant PIN. That's how you can listen through the phone and see the presentation. If this does not work, please email my colleague Liz Tansey at ltansey@cchn.org. Please note that today's event is free for participants from sites that are Health Center Program grantees, federally qualified Health Center lookalikes, and primary care associations in Region 8. All other participants will be billed after the event. Lastly, if you have any questions, please type them into the chat box in your display and we will answer them at the end of today's webinar. CHAMPS is a nonprofit membership association of community, migrant, and homeless health centers in Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming, representing Region 8. CHAMPS was founded in 1985 to unite Region 8 health centers in an advocacy and mutual support network of these community-based providers of primary care and related services for underserved communities in the Mountain and Plains states. CHAMPS is dedicated to supporting Region 8 community health centers by providing opportunities for education and training, networking, and workforce development. CHAMPS members receive access to Region 8 specific data, networking opportunities, reports, publications, educational resources, trainings, and more. For additional information about CHAMPS programs and services, including the benefits outlined on the slide, please visit champsonline.org. The link is in your chat box. Colorado Covering Kids and Families, also known as CKF, is a statewide coalition-based project with a mission to increase access to affordable health coverage and high-quality health care by ensuring that Health First Colorado, which is Colorado's Medicaid program, Child Health Plan Plus, and subsidized private insurance through Colorado's state-based marketplace consistently meet the needs of low-income Coloradans. CKF is a project of CCHN. CCHN represents Colorado's 20 community health centers and their patients. CCHN is dedicated to providing resources to ensure that community health centers are strong organizations and are providing the highest quality care, and is committed to educating policymakers and stakeholders about the unique needs of community health centers and their patients. For more information about CCHN, please visit cchn.org. And this link is also in your chat box. Today's webinar, A Guide to Storytelling, Unleashing the Power of Personal Narrative, is the first in a four-part CHAMPS CCHN 2017 Outreach and Enrollment Distance Learning Series. You can find out more about the series as well as the dates and times for upcoming events on the CHAMPS Distance Learning webpage. The link is in your chat box. For additional information, please refer to your handouts. If you have not received the handouts for today's event, which include both slide copies and additional resources, you may print or download them at any time during the event by clicking on the file name in the Shared Files widget on the bottom right corner of your display. Now I'd like to introduce our first speaker, Michelle Ames. Michelle is president of Michelle Ames Consulting, a communications consulting firm specializing in healthcare and public policy communications. She has worked at a political firm specializing in healthcare and public policy communications. She worked as a political reporter for the Rocky Mountain News and then as a communications specialist, focusing on complex public policy questions and debates. Michelle, thank you for joining us today. I will now turn it over to you.
Thanks, Valerie. I appreciate that, and I appreciate very much being able to be here with everyone this morning. I am personally committed to the idea of bringing this personal narrative, bringing these stories to bear as we discuss and debate our public policy, especially within the healthcare framework. I think it's true to say, as we look across the last several months of what is really, I think, by any measure, crazy-making debate at the federal level, I think we can all agree that very few things have cut through all the clutter and the noise and the politics in the way that people's personal stories about health care, their access to the healthcare system, their need for Medicaid, and other important topics in this arena have done. And so I'm really thrilled to be here with you today talking to you about this. I want to do a couple of things today. One, I want to get you fired up to keep gathering those personal narratives, those stories that really have impact, even though I know that on the ground and in the actual work, it's really tough work. It's sort of hard rock mining with your fingernails, but I believe in it so strongly that I'm thrilled to be here to just sort of try to get everyone fired up to keep doing this work today. And then second, I'd like to, and hopeful to be giving you some actual tangible tools that I think or that I hope will be useful to you in doing this tough work. And so I give you this high-minded speech from Abraham Lincoln. I'm not sure that high-minded speeches from politicians are possible anymore, so we're going to go way back in history and get one here. But I believe that it's true that we have to reach hearts as well as minds if we're going to move this debate in the right direction in regards to helping people get access to health care, keeping them on insurance, and those sorts of pieces. So I wanted to start this conversation with you by just showing you a couple of examples of some work that we've used here relatively recently in Colorado, but it's applicable everywhere. These two examples that I'm going to show you to start are from the effort that a large coalition of groups here in Colorado undertook in order to see the Medicaid expansion happen a few years ago. And this effort was actually structured around our legislative body. We put educational information about the value of Medicaid in front of our state lawmakers every day for the entirety of the bill's existence, which was roughly around 2.5 months in terms of just moving through the process. And the reason that I show you these stories is a couple-fold. One, I show you these stories because I will tell you, as we put facts and information and stories about Medicaid in front of our lawmakers here, and we're tracking their uptake, the uptake of all of that educational material, far and away, the most read information that we put in front of lawmakers through that 2.5 month span were the stories. They were people's stories. They were stories of their constituents or other lawmakers' constituents who had used Medicaid to their benefit. And so you see here the first one I'm showing you, a story of Cynthia Osborne up in northeastern Colorado, who was able to access Medicaid and quite literally save her own life by getting treatment for breast cancer. She was gracious to share her story and was a wonderful addition to a lot of other information we are providing on Medicaid. The second story that I want to show you comes from the western slope of Colorado, the Barber family, who the children use Children's Health Plan Plus here in Colorado, or CHIP nationally. But the parents at the time had not been able to access health care for themselves for many, many, many years due to restricted finances. And so the Medicaid expansion was also important to their family as well in terms of keeping their entire family healthy. So the first piece I want to tell you is just that I know from personal experience, and I'm sure that all of you do as well, that these personal stories cut through the clutter and make it about people and force lawmakers to move away from a reliance on numbers and budgets and math equations, and force them to think, at least for some period of time, about the actual human beings for whom the public policy they're making has real impact. The second piece that I just wanted to draw out for you here is that these stories don't have to be long and complicated and go on forever and ever. These stories can be very short, like this one. Before we took down some of this information electronically, you could have clicked through here and read a much longer story about the Barber family. But just this small amount of story has impact with lawmakers and has meaning for them. And so I encourage you to not think about it as a Herculean task that's going to take forever and needs to, be your magnum opus, but that there are ways to collect these stories and disseminate these stories and use these stories within the public policy context that don't have to be as large and involved as we sometimes think about that they might need to be. So just to sort of wrap up my cheerleading part of my presentation to you, I just want to reiterate again why we need to go to the trouble of doing this, because, again, I know that these stories are tough to gather. I know that it's hard to get some of our systems that could gather these stories for us going in the right direction. I know that some of the stories we're trying to tell are from people with very complicated stories to tell and can be hard to sort of work through, but I believe because of the ability to cut through the clutter, because it makes the story of public policy about people and not numbers, and because it connects our policymakers to their actual constituents in many cases, it's worth the effort. And in fact, it is maybe one of the only efforts we're all going to undertake together that really can have a big and substantial impact on the policies that we're trying to influence. So this is one last example for you of some recent work that we've been doing here in Colorado. I'd just like to show you this one because I want to show you that I think there are ways to couple all of the work together so that we can get the overarching influence that we're hoping to get. This is a Colorado Health Policy Coalition. This group came together shortly before the 1st of 2017 to try to talk to our congressional delegation about what we hope for their work at the federal level in regards to the Affordable Care Act and now what we know as the American Health Care Act. And so what we tried to do was to do some, on the right-hand side here, do some basic fact sheets and some basic education around what healthcare looks like, health insurance looks like in Colorado, and uptake of insurance and all of those things in terms of the Affordable Care Act. And then on the left, you see we are coupling that with some really compelling stories from Coloradans, again, who have used the Affordable Care Act or to access the health care they need. This story coming from a lovely woman here in the Denver metro area who is battling colon cancer and is, will have for the rest of her life, even if she manages to win her battle with colon cancer, will have chronic conditions that she will need to manage for the rest of her life. So again, just sort of coupling these numbers and data that we need them to think about with the actual human beings who we really want them to think about. So I just want to cover just a few thoughts for you on the process of getting these stories collected, as well as some common pitfalls. So this is the part of my presentation that I hope for you will be some practical tools that you can use. And I will say, as I move through this, some of the things you'll see here are also downloadable for you on this platform as well. And I would be happy for you to use them in whatever way makes sense. So first of all, I want to talk to you a little bit about getting some resources in line. before you start the process. And I would suggest that, most of these things run concurrently. Most of the resources, the process, the background, and the assets all run concurrently as you're working through the project. But just sort of getting some of these resources in line. So first of all, resources that I would suggest to you in these storytelling situations is some sort of a checklist for the folks who are doing some collection for you. Oftentimes these are folks out in the clinics and other facilities who are helping with this process. So giving them the tools that they need to feel comfortable trying to gather the stories for you and feel comfortable that they are handing off to you the information you need to pick the collection effort up and run with it. I've often found that in this resource toolkit, it's helpful to have some tips for storytellers and story collectors in terms of what parts of the story could be compelling and those kinds of things. Certainly, as the story gatherer, if it's you or someone you hire, they will ultimately have to hone in on this set of facts and what's going to be encompassed in the story. But helping people start the process is really important, and I think will enhance their ability to actually help you collect these stories. And finally, another resource that you need in your back pocket is some level of release for individuals who will be doing the storytelling themselves. This is a legal, covering your bases legally to make sure that they are aware and understanding that they are going to be releasing personal information. You are going to be releasing personal information about them as well, including their health conditions, as part of the effort that you'll be undertaking. You'll note on the release that's available to you in the downloads that release covers everything. I think it is irresponsible, honestly, and not only, probably also legally irresponsible, but certainly morally irresponsible to not be clear with our storytellers as we're working through this process with them, that once we put their information out electronically, we will not be able to be in control of it anymore, and we will not be able to guarantee where it goes or where it doesn't go. I think it's only fair to remind them of that, given that most of us will be sharing some portion of these stories that we would share electronically, and once we've shared them out to our networks electronically, we have lost control of that information entirely. And so I think that's an important thing to tell them, and your releases, whether you use one of your own devising or one that we have available for you today, need to make that clear as well from a legal standpoint, to just make sure that your bases are covered in saying that you don't know where it's going to go. Secondly, the process. I think the process, you need to have your process for gathering the story, drafting the story, getting the story approval, and then getting it disseminated clear for yourself before you start, especially as you're dealing with your storyteller, so that they understand what's going to happen, how the process will move, where they will have an opportunity to, talk about the story with you, maybe make revisions, make corrections, and so that they really fully understand how the process will work, especially given that some of our storytellers do have complications in their lives. It also just helps us make sure from our side of the fence, the story gatherer side of the fence, that we're going to have their cooperation through the process, or at least we're more likely to have their cooperation through the process, so that we don't lose them, and that they know that we're going to talk to them once, and then we're probably going to come back to them again with the content for their approval to make sure that we got everything right. So just making sure that we kind of make that process clean and clear for everybody participating. Finally, the backgrounding part of this process. So I know that many of the storytellers that we often end up working with are folks who have been a part of a clinic or somehow are connected to organizations that we're connected to, and so the instinct there is to think that we know them, and so we understand what their life looks like and what their story looks like. While that may be true, I don't think the reality is that nobody knows anybody, in truth, and so I think we need to always consider that part of our role in the story gathering process, whether it's us ourselves or someone we hire to do the story gathering, has to be backgrounding the individual independently. And this is also, I think, quite importantly, a protection for the storyteller themselves. Sometimes, folks who want to tell their story get caught up in the passion for telling their story and the issue that we're trying to talk about, and forget that they have things that might be available electronically that would be embarrassing to them, or they would prefer the whole world not see. And so it's our responsibility as part of the story gathering process to make sure that we have background of these individuals, that we have continually talked with them about what might be available electronically that they might rather folks not see, or not be widely disseminated, and to make sure that we either help them remove that information or we exclude them, honestly, from the story gathering process because they're not good candidates for telling story. And finally, the assets. And again, this needs to be part of the overarching planning process, which is think about the assets that you want to create, the communications assets that you want to create from these stories before you start the story gathering process, so that while you're doing the story gathering, you have these assets in mind and you're collecting everything you need to accomplish this, whether that's photography, whether it's video, whether it's a certain way that you want to tell the story, so that you gather the right pieces of information so that you can tell the story, and you can do it in a kind of a compact way so that you're not asking your storyteller to engage with you more times than you need them to in order to get the work done. So one of the common challenges that I have experienced with organizations as they try to do the story collection and story gathering is that you've got a lot of folks out in clinics and other places who are the perfect people to help create this pipeline to get the stories moving and to get the stories captured, and they are oftentimes or can sometimes be hesitant to do it, feel like it's not part of their job, feel uncomfortable having the conversation about story gathering. I mean, many barriers to getting them to help you with this process. And so one of the things that we've used in the past here in Colorado with some story gathering efforts we've done that has eased the process and helped the process is really a kind of a questionnaire that you can put in the packet of information that these folks on the front end are using and working through with the individual regardless. And this questionnaire just helps them capture a little bit of information about the person, and a little bit of information that you might use as the story gatherer down the road once they decide, well, look, I've got 5 people who could tell this kind of story, so and no one to tell this other kind of story, so we need to sort of be looking at new folks or new storytellers. But just sort of help to ease the process for your internal folks so that they can help you build this pipeline in a way that might be a little bit more comfortable to them than just sort of trying to randomly start the story gathering process without any help or support. So this, again, is available to you for download, but just to show you a little bit about what I'm talking about here, it seems like this has worked for us here in the past. Additionally, I just want to stress again how important it is to have releases for the individuals you're doing the storytelling with. While you should be throughout this process talking to them about, what this is really going to look like and how their information will be shared and all of those pieces, it's also important to just legally cover your bases by making sure that you have a document that in which they're officially acknowledging that they understand what you're going to do with their story and what you can't control about what you're going to do with your story and how their story will be used. Again, this is available for download below for your use, or at least for your review, so that you can see what it's looked like from our perspective, and certainly you want to consult your own legal team to make sure that you have one that they are happy with as well. Finally, I want to encourage you, as you're walking through your planning process, to create the broadest set of information you can when you're gathering information from your storytellers, so that you can use it across as many networks as possible, and you can create the broadest set of assets possible. Because this effort is hard to do, and because it is very time consuming, getting the most bang for your buck out of these stories is the best possible way to go. So if that means, doing a little bit of photography while you're story gathering, making sure that you have video, doing as much as you can within the budget you have, to create as broad a palette of resources as you can is really, really valuable, because I think we all know that the way that we share information is so varied and so diverse, and the way that people see information is so varied and so diverse, that the more opportunity you can have to put the story out there, the more mileage you get from the stories you can collect as you're working through what can sometimes be a bit of a cumbersome process. I wanted to take just a moment and talk to you a little bit about some of the common pitfalls that I see when we're trying to work through story gathering and story dissemination, in hopes that they can be avoided in the efforts that you might undertake. The first one that I want to talk to you about is the curse of the perfect story. We oftentimes work in coalitions or with organizations for whom it's really important to tell a story that matches the issue they're trying to raise. And I think that that's always a noble goal, and I think that it's certainly a goal that we should try to achieve wherever we can. But I have also seen many, many storytelling efforts derailed because those involved want to find the perfect story. And in that, I mean, we want to talk about an issue that requires us to have a 24-year-old woman who is a single mom with 2 children, both of whom have been on SHIP for at least 2 years, and the mother signed up for a different program, and Jupiter and Venus have aligned, and all of these other very specific conditions are met, and therefore we can go forward with the story gathering process and tell the story. While it is a wonderful thing when the cosmos align to allow you to tell the exact perfect story, it is oftentimes the death of a story gathering effort, because it is so hard to find these needles in the haystack. So I would submit to you and suggest to you that starting out with a broader goal for the storytelling effort, which is just we want to show the value of CHIP to families. And wherever you can align the storyteller with maybe a weedier issue you want to talk about is great, but is not the death knell for your entire storytelling effort if you cannot do that. So I just really encourage you to not allow the perfect to be the enemy of the good when we come to a storytelling effort, and oftentimes that can happen. The second sort of common pitfall that I see that I'd like to encourage you to deal with and to deal with head on and up front is this idea that we need to be very ginger with the storytellers and not scare them about what's going to happen to their story and who might see it and how it might be received, and therefore we move them through the storytelling process by not asking them a difficult question and not being clear with them about how their information will be used. And then we get to the end, and when the rubber really does hit the road, we either lose the storyteller and all of the work that we put into gathering their story, or we put a story out there and the storyteller shouldn't be out there. And it is a detriment to our own organizations as well as a detriment to this person who now has embarrassing information that's being uncovered about them. So it is my philosophy in working through the storytelling and the story gathering process that we are constantly honest with the storyteller, and we are constantly asking those somewhat difficult and uncomfortable questions as we work through the process. And I believe at a very basic level it is our moral responsibility to do so, because they need to understand what they're doing. And it also, quite frankly, from just a very practical standpoint, will eliminate storytellers who probably shouldn't be telling their story earlier in the process than later in the process after we've already invested a lot of time and energy trying to gather their story. So this is my journalism training coming through, I understand, but this is not a polite conversation that we're having with our story gatherers about, the weather and how the Rockies are doing. This is actually a very clear and direct conversation we're having with them about what we're going to do with their story and what they need to understand about that process for themselves. Another common pitfall is, we have the good fortune of stumbling across someone who has a good story to tell and is ready to tell their story, and so we jump into the story gathering process before we've done any of our planning, any of our process planning, and any of our preparation for gathering the story. What this is just a recipe for spending more time working on this than you would otherwise. And oftentimes it can cause real problems at the end when you're trying to create your assets, or legal problems because you don't have the releases you need, or you've got HIPAA issues all of a sudden. And so really, while it's exciting to have storytellers come forward and get ready to gather their stories, we really do need to make sure that planning process has occurred first, so that we're ready to walk them through in an orderly fashion and get all that we need and take care of their needs at the same time. And finally, and this I probably have hammered at enough, so I won't dwell on it forever, but you do not know anybody. Nobody knows anybody until they've been backgrounded when it comes to the story gathering and electronic dissemination of stories. So please do not allow a contractor you hire, or do not allow yourself or any staff member you be working with on this to just say, we know this person, it's okay, we don't need to do the backgrounding. We always need to do the backgrounding, and this can be as simple as just spending an hour online looking around on Facebook and Instagram and a few other common places where people may post information, to just make sure that even with all of our questions to the storyteller themselves, we don't have an individual who has information out there that would be embarrassing to them, that we don't want others to see. I will say that one of the common practices that I use while I'm gathering stories with storytellers is to ask them, if they are on social media, to go on to social media and turn all of their protections up to their highest level. I've noticed that people who fall in the 40 and over category typically have their permission set very high so that only their friends can see their information. But I've noticed sometimes when working with folks 40, specifically millennials, that they are less concerned about those privacy settings sometimes on their social media. And so for the duration of a process where we're telling somebody's story, I often encourage them to just sort of fix that and turn them up as high as they can, at least until we kind of get through the process and they go with their story being, for a little additional protection for that individual. So finally this morning, I will just close again with just a small bit of cheerleading. These are some photographs of storytelling efforts that are currently underway in Colorado or have been underway for previous CHIP reauthorizations, some issues that we had with physician reimbursements around Medicaid, and currently some work that we're doing to try to help influence the federal conversation on the Affordable Care Act and the American Health Care Act. So again, I really am thrilled to be here with you today and to have this conversation with you, because I fervently believe in the value of the storytelling if we're going to influence public policy in a positive direction as it relates to our national healthcare framework and the healthcare frameworks of our individual states. But I just can't say enough about the value of storytelling and its ability to really have impact on public policy. So, thank you.
Thank you, Michelle, for these great insights and practical tools. And just as a reminder, if any participants on today's webinar have questions for any of our speakers, please remember to type them into the chat box at the bottom of your display, and we will answer them either at the end of today's webinar or we'll answer them individually. Next, I would like to introduce our second speaker, Jennifer Morse. Jennifer is the Vice President of Development for Salud Family Health Centers, located in Fort Lupton, Colorado. She is responsible for grant funding, along with supporting community engagement efforts and leading policy and advocacy efforts. Jennifer, thank you for joining us today. I will now turn it over to you.
All right. Well, thank you all for joining us today. I'm really thrilled to share some of the practices that we've done at Salud for story collecting efforts. And yeah, I'm going to give you kind of a nuts and bolts perspective from how we've put a form into the clinics and that collection effort as they come back to me and how we're using them. So first and foremost, our mission. So every health center, pretty much has some variation of the same mission because, of course, we're all out there to provide access to healthcare for our communities. So at Salute, it's to provide a quality integrated healthcare home to the communities we serve. And we really see the story collecting effort as an extension of that mission. We all know when we provide services and we get community members enrolled into Medicaid or CHIP, that of course is making sure our mission is living and breathing, but we really see advocacy efforts, which I'll highlight probably quite a bit during this presentation because that's one of the main modes of using these stories. But really we see this story collection effort as an extension of that mission, making sure we're connected with the patients who use our services and understand what their needs and concerns are. All right, so our history. Every health center has a great history. Salute is no different. We were founded in 1970 up in Fort Lupton, Colorado, a very hot Fort Lupton, Colorado today, I might add. It's in the 90s here. And we really were founded in response to the critical healthcare needs of the migrant farm worker population in this area. So at that time, this whole area was largely agricultural. A lot of that has changed because of course, population growth. But our roots are still very much in the migrant community. So we are both a migrant seasonal farm worker health center and also a community health center. And then just for context, just before we get into the presentation, where we are today. So of course, we're a federally qualified health center, which means we're a private nonprofit. We operate 12 clinics in 9 communities in 10 counties in northern Colorado. So if you picture the state of Colorado, we're kind of that northeast quadrant. We employ 560 fantastic employees. And then we operate an integrated healthcare model where medical, dental, behavioral health, and pharmacy are truly integrated to perform and to respond to patient needs. And we are PCMH accredited by NCQA and actually HHHC as well right now. So annually, these are good old UDS numbers. So 76,000 patients, 605 patients that we provide 331,000 unique visits to each year. So why did we decide to start collecting stories? I think our path is probably similar to many of you on the phone in that we would consistently hear these really great patient stories. You would hear them from providers, you'd hear them from care managers, you would hear them from dental assistants, front desk, you name it. We were hearing great stories all the time. And we would always share them anecdotally. And it helped when we would talk to the local city council. It would help when we would talk to a funder. But really, we didn't really have a formal way of capturing them. So we would reference them later, of course, but we would lack the specifics or contact information. And we think, it'd be really great to have that patient talk to, say, Senator Bennett or Congressman Kaufman. And we would think, but we don't know who they are or how to get a hold of them. And we could, of course, do some digging, contacting a provider and saying, remember that story you told me? How do I get a hold of that patient? But it really was never a formal process. And so, the second point, of course, is that we all have powerful data around the access we make. So everything from our quality outcomes, our fiscal measures that we report in UDS, aside from just our regular reporting that I know all of us do, that really speak to the cost savings that we provide to the healthcare system and the quality care that we provide. But we really didn't have that human experience piece, which, of course, is why all of that impact matters. So we just kept thinking we really need to do better at rounding out the whole story. I'm jumping ahead a little bit, but one thing I think all health centers have recently started to do is make the case for the effect of cuts to Medicaid, and then, of course, the fiscal cliff, so that cut to our federal grant if that were to go through October 1st. And so, we were really good at speaking to what those cuts would mean to Salute, but we didn't have on that same fact sheet some really good patient stories and patient impact. And so, again, this just kind of rounds out that whole story of making sure you have data, but also making sure you have the human experience. And then lastly, I think every health center, but because it's required by HRSA, is required to have patient satisfaction surveys. So at Salud, we collect them on iPads at the front desk. Everything from how well do you feel like you're listened to by your provider, your wait time, those kind of standard patient satisfaction questions. But we really didn't have that same kind of tool to capture the patient experience. So we felt like we had an obligation to better understand our patient experience, and then, of course, to share that experience with our community to garner support. So, at the end of the day, we want to make sure our communities know who we are and why we matter. And again, like when advocacy efforts come up, the way I kind of always think about it is if you're telling someone a story, if you have to start, the very start every time, it takes you a long time before you get to your ask. But if your community member or your mayor that you're speaking with already knows who you are, already understands the work you do, and already understands the impact, then it makes for a much easier process and more timely process to ask for support on different efforts. And of course, since timeliness is always so key in advocacy, we really use this effort to kind of shorten that length of time between telling your story about your health center and then going to the ask. So what do we use? This is our story collecting form, English and Spanish. Everything at Salud is English on the front, Spanish on the back, or Spanish on the front, English on the back, however you want to see it. And this is a paper form. We actually thought through, using electronic format, and sometimes we just go old school. We know patients are waiting in the waiting room for visits, only I'm sure a few minutes, but they are waiting. And so it's a good opportunity when they check in to ask them if they would like to share their personal story with us. We give them a clipboard and a pen, and they have an opportunity to write this out. We thought about doing it on iPads, but we were concerned with whether you lock them down or if there's kind of a queue waiting to get on an iPad, or it just also feels not as intimate, kind of typing into a technology pad as opposed to kind of expressing it on pen and paper. And then I will say for a lot of patients who may not, have the writing skills, we have staff available who say, I can certainly also help write your patient story down if you would like me to do that. So we based our form off the questionnaire used by our PCA, our awesome PCA, I might add, the Colorado Community Health Network, so CCHN. And we felt like if we kind of mirrored our questionnaire on theirs, we could hopefully over time have a greater volume. Hopefully all the health centers in the state would start kind of collecting those same questions, and then you would just kind of have a larger body of evidence all asking the same thing. I already mentioned we decided to use paper. It really came down to the ease of filling out and collecting. And then since that screenshot before, it was kind of difficult to see what the questions are. Those are our questions listed there. So number one, how has receiving care, medical, dental, behavioral health pharmacy at Salud helped you? So a very open-ended question. We try to just keep it open-ended. And then how has the Affordable Care Act, of course a lot of people know it as Obamacare, helped you? And then thirdly, how has Medicaid helped you? And then lastly, anything else you would like to share about receiving health services? So locations, we decided really to have them staged throughout the clinic. It's everywhere from enrollment specialists, which seems like a natural environment given that those great folks are helping patients with enrollment. And so it's a good opportunity to say, what does coverage mean for you? Front desk, of course, is always going to be a natural entry point because that's where patients first come. They're going to have some wait time, so we might as well, ask them if they would like to share their patient story and do so there. We also have stacks of them at pharmacy, medical, and dental. They are pretty much everywhere through the clinic. I've been surprised as I'm out at sites. They really are well distributed at all points, and all staff are really engaged in the effort. we, first and foremost, we want to make sure this is easy to deploy and easy to ask staff to ask patients to participate. And of course, by that I mean health centers are incredibly busy operations, lots of activity going on. And, you know, I think we're always mindful of the ask. So if we ask for a heavy lift, it's not as likely to get done given all the other pressing priorities in a busy clinic. So we're trying to make this as easy as possible to really get staff engaged and get them excited about asking patients to participate. You know, we've actually found that staff are pretty comfortable asking for people to fill out this form. I think a couple reasons. One is they know these patients, they live in the community, and they really kind of operate as an extension. If you would like to share your story today, we would love to have it. And then I think also we've had problems with like asking folks to sign up for voter registration and those efforts, but this one has been pretty well received. And then, of course, I just mentioned how clinics get these forms just from a logistics standpoint, so they can, of course, simply make copies themselves or order from our printer. So how are we publicizing this effort? A couple ways. One is staff are the front lines of this effort, so staff are engaged. I've talked to staff at all staff meetings to get them excited. Certainly their center management directors are the leads on this. And then good old bathroom stalls. So as we all know, many bathroom stalls have information when you're going to the bathroom, and you definitely have mentioned. So 3 things that we're working on is getting people to sign up as advocates. Number 2, you'll notice on this sheet of paper is to submit your patient story, so we tell them where to do that. And then thirdly, where they can learn more about advocacy efforts. I'm going to move a little bit faster just because I'm looking at the time. But our story form. So what happens to all these stories? They get sent back to me. I'm in Fort Lupton in our administrative office. They get sent back through interoffice mail or scanned in. We are saving them in an Excel file, so nothing particularly fancy, but we want to make sure we have a database, and they're getting scanned in as they come in hard copy. A lot of patients have actually taken this form. This is one example. And they've said, wait a minute, I really want to flesh this out. I have a lot that I want to speak to. And so they've actually taken the form home. They've written, pages and pages about their experience at Salud. So we have a lot of much longer patient stories captured too. And one thing I should note on our contact on our story form is at the bottom, it definitely asks for contact information. It says it's not required, but we would love to be able to follow up. And it just asks for the best either email or phone number that we can reach them, because we definitely want to be able to connect with these patients down the line. So how have we been doing so far? This number is actually a little bit lower than it should be, but we started this in February 2017. We have collected right around 100 stories. I know it says 66 there. And then 2 staff stories. So we're also asking staff, if you had a great experience, please take a moment to jot it down, and, we'll write that up. And then, I have just a couple quotes, one from a patient, one from a staff member. I'll let you look at those later, just because of the time. And then how we intend to use these stories. So, media request, we want to make sure if we have that contact information, we get a call in from, say, Longmont Times Call, we can go, hey, we had this patient who had this experience. Let's contact them and see if they might be interested in talking to a reporter. Marketing, public relations, so on our website, on our flyers, in social media, we've been putting a couple quotes. Community partners as part of telling our story. So that's everything from hospitals to our partnering agencies, our state Medicaid office, and then I think also with advocacy. So, often when we meet with a member of Congress, the most powerful piece is if a patient can come to that visit. Patients can't always come, but we can bring these patient stories with us. And then, of course, as I mentioned, just having a one-pager that really captures not only the effects of a cut to Medicaid and the fiscal clip, but also really rounding that out and telling a patient's story. And then lastly, we really are just getting started. So I would like to think there's a lot more to come. I think we really just need to make sure it become going push out at the clinics, because I do think patients are engaged or staff are engaged. We just need to kind of keep reminding them that this is an ongoing effort. And then, of course, lastly, why we all do what we do every day is really on account to serve our communities and our patients. And so we really look at collecting stories as an extension of that effort. And with that, that is my presentation. Thank you.
Thank you, Jennifer, for sharing how Salud Family Health Centers incorporate storytelling into their workflow. Just as a note, we're running short on time, so any questions that are put into the chat box, I will put together and we'll make an FAQ, and I'll make sure all participants get the answers to those. So thank you for your understanding in that. Now I'd like to introduce our final speaker, Stacy Anderson. Stacy is the Deputy Director of the Montana Primary Care Association, the PCA for Montana's 17 community health centers. She is responsible for statewide communication, government relations, strategic partnerships, and special projects. Stacy, thank you for joining us today, and I will now turn it over to you.
Thank you, Valerie. I just am really following up on all the great work that Michelle and Jennifer have done. Michelle's process that she laid out for CCHN is very much what the Montana Primary Care Association follows as well. And then Jennifer's work at Salud is really amazing. When I think about the work that they're doing, the size of their community health center, it's sort of mind-blowing, though, considering how rural Montana is. They serve as many patients as 3/4 of the entire state that we see in all of our 17 health centers. So that leads me to sort of my main talking points about why the Montana Primary Care Association is sort of spearheading the work around story collection work in our state. And the first one really is capacity. Really only one of our health centers in Montana even has someone like me on staff. The rest are so small or they're co-applicants with county health departments that they're limited in doing this work. That doesn't mean they don't have stories to collect and stories to share, but they just don't have the capacity to do it. And then the second piece is around policy. In Montana, our PCA is really sort of the statewide voice for our community health centers, not only at the state legislature, but with our federal delegation. And so we wanted to be able to leverage and understand the stories that were out there, whether they were rural stories or more urban stories, whether it was a Medicaid story or an ACA story, to really pinpoint and target what message we might be wanting to carry to our decision makers. Next slide, Valerie. So a little bit of history. I mean, I think we've all lived through the 2015 fiscal cliff, but in Montana, we also had been building up since 2013 to pass Medicaid Expansion. So we really launched our PCA story collection work in 2014 in a formal capacity and engaged our health centers not only in preparation for our 2015 legislative session, but also understanding that same year that we had a fiscal cliff that we were trying to address at the federal level. We also worked statewide with our certified application counselors. So in Montana, the PCA organizes and oversees what's called a Cover Montana group, and that is all the certified application counselors and navigators and O&E staff for the state of Montana. So it's not only community health center staff, but it's really the broader population, of which we have, I think, about 130 people who are working around the state around enrollment and ACA enrollment, marketplace enrollment, and then Medicaid expansion. We actively traveled the state and collected those stories in person because we had a staff person who was dedicated to that work. And so the health center would sort of identify someone, and we had the forms that Michelle spoke about and that Jennifer also spoke about, the paper collection pieces and the HIPAA waiver, and had gone through all the legal to make sure we were getting the appropriate sign-off from our patients to share that information and then come in and collect it. We collected those stories, and largely they were just stories. We hadn't thought through necessarily the active packaging of all those stories, but we did know which speakers we wanted to cultivate and really help understand how they could communicate their story in different ways. We used those stories to create a printed document that we shared with our decision makers. We also used those individuals to come up and testify at the Montana legislature on Medicaid expansion and how important it would be to their lives. So we did all that prep. We did all the media prep. We did the testifying and testimony prep, and really helped the individuals we identified for that work be comfortable in that role. And then ultimately, because we worked with such a broad coalition, not only the Certified Application Counselor Coalition, but also the kind of the policy-making coalition at the statewide level, those groups that were actively involved in trying to pass Medicaid expansion in Montana, they knew they could come to us if they needed a public speaker, or they needed, someone to attend a rally and share their story, or they needed a provider. They knew that we could provide that individual. Next slide, please. So obviously we got through 2015, Montana passed Medicaid expansion. We got through that fiscal cliff, and then we, entered 2016 and 2017, and we just sort of realized that we're all back. It feels like square one, or even worse than square one, in terms of the policy and funding threats that we're facing for our patients and the Medicaid expansion population. So we wanted to continue the project and really go bigger with it, and we prepared how we were going to do that right up from the start. So we submitted a proposal to a funder who was really concerned, particularly around the Medicaid expansion program, to help fund that work. So not only did we have our state staff person still involved in story collection, but we also brought a consultant on who was good at media and marketing and knew how to package some of this information that Michelle talked about, making sure to think through what we would want. So we wanted video, we wanted audio, we wanted still, photographs. We wanted to be able to take those stories and turn them into letters to the editor or op-eds, and really just sort of run through with the storyteller what the options were in terms of how we might communicate the work we were going to do. And the funder did fund that. So we were able to get the funding to augment what the PCA could do. Next slide, please. So from that funding, we created a website that wasn't necessarily directly linked to the PCA, but is managed by us. And it's the MontanaCoverageMatters.org website. And you can see on the left that that's the landing page, and that's off my phone. So that's a screenshot off my phone. That's what it looks like if you're coming in on a smartphone. And then if you click that Share Your Story button, then you go to this next screenshot. And I've actually scrolled down a little bit. What you first see are sort of your name, your address, that sort of thing. But this is how we set up what kind of stories we were trying to collect. So not only are we trying to drive community health center patients, in addition to using paper forms still, but also online. We're driving community health center patients into this portal. We're also encouraging our partners to use this as a way to collect stories if they don't have the capacity to do it themselves. So this came directly out of that thinking through, we want to have an ongoing conversation about why Montana coverage matters, whether it's Medicaid, whether it's Medicare, anything that we might see in the future as a policy threat or a policy opportunity. We can quickly change this page to reflect what's going on. So next page. So then we also continued on. Once we collected those stories, here's some examples of what we did. So on the left side is a screenshot of the MontanaCoverageMatters.org site, where if you click on the stories section, you'll see some of the top 3 stories that we've collected and are promoting. You can see we have the still photographs if we have the authorization to use their images, and sort of the snapshot, and then they can go on to the stories. Then you can see on the right-hand side, we created a Montana Coverage Matters leave behind, or, it's not a brochure, but it's a full 8.5 by 11 page pamphlet that tells, I think, up to 10 stories. I'd have to count, but it really breaks it down, running the full gamut of people who've benefited from the ACA or Medicaid expansion. And this is something that we take to most of our public meetings, all of our conferences. We take to DC when we do Hill visits. We take to our Montana delegation in the state legislature. We use this with media and using it with funders because, next slide please, we are looking at what this really means. I mean, the policy threats today at the federal level, and then no matter what happens at the federal level, Montana's Medicaid expansion program expires in 2019. We are going to have a Medicaid conversation in Montana in 2019. So we are approaching funders about supporting a statewide paid media public education project that takes these stories, that takes the stories of our providers, that takes the facts about Medicaid and really amplifies it across the state. And we've kind of created a narrative arc and all those things. And I don't have a status update on this funder request. We have secured some funding for it, but not full funding. And we're hoping to hear next week whether one of our statewide foundations is really going to say that this matters, helping break down the myth about who a Medicaid patient is in Montana. Because as you can see there, 1 in 4 Montanans is a direct beneficiary from Medicaid. And that's the work we're trying to do. So not only are we creating a narrative arc around Medicaid, but we're creating an arc around how we're treating our storytelling work at the PCA and with our health centers and across the state. So it's been an evolution. So start small and then keep building and keep having the conversations about why telling our story and talking about our patients is so important. So that's all I have, Valerie. So I'll kick it back to you.
All right. Thank you, Stacy, for sharing how the Montana PCA is a leading example on how primary care associations can engage in health center communities in storytelling. So we do not have time for questions right now. So like I said before, we will take all the questions we've gotten and submit and create an FAQ, and then we'll send those out to participants after the event. So just to wrap up, the next webinar in this series is Leveraging Outreach and Enrollment Assisters in Community Health Centers. This will take place on Thursday, July 27th at 11 a.m. Mountain Time or 12 p.m. Central Time. This webinar will focus on how health centers can support their outreach and enrollment assisters by identifying areas for skill development and collaboration with community health workers. We will be joined by speakers from the National Association of Community Health Centers, also known as NAC, and from the Michigan Primary Care Association. And this registration link will be in your chat box in just a minute. And then lastly, I just want to say thank you to Michelle, Jennifer, and Stacy for sharing their expertise with us today, as well as for my colleague Liz Tansey from CCHN and her continued collaboration with CHAMPS on this webinar series, and to all of you for joining us today. Just as a reminder, today's webinar will be archived on the CHAMPS YouTube channel. A link will be sent out to you when the webinar is available. To learn more about upcoming webinars and other upcoming and archived CCHN and CHAMPS events, please visit cchn.org, and under About Us, click on the link to Events and Trainings, or visit champsonline.org, click on Events and Trainings. As always, your feedback about today's webinar is very important to us. When you exit today's event, a short survey will open on your computer. We really appreciate you taking the time to fill it out, and as it helps CHAMPS and CCHN create relevant and interesting trainings. And lastly, by attending today's webinar, you are showing your commitment to the Community Health Center mission and your passion to strengthen the network of community health centers in Region 8. And as a late anthropologist, Margaret Mead once said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Thank you again, and we hope to see you on the next webinar.